after the World Trade Center attack, the therapists were nervous. The patients were frightened and nervous and didn't know what to say either. So very few people were interested in verbal therapy immediately. Very, very few.
St. Vincent's is the closest major trauma center to Ground Zero. I was assigned to a subacute ER in the hospital, and we had all this equipment, but very few patients coming through. It was really a firefighter who was in the subacute ER who was so distraught looking. I asked him, did he have anything that he wanted to say, and he didn't.
One of the concerns in the trauma field has been how to help people who actually avoid treatment. And one of the things is we had to try and figure out why they're avoiding treatment. And it's become clear that the major reason is that this is the group that re-experiences the trauma by even talking about what happened. So the last place they're going to want to go is talking to a therapist.
I was a psychiatric nurse. I was seeing that we really needed to be doing something different. And I did get permission from the medical director that evening to start ear acupuncture the next day. We were very busy. There were days that we were seeing up to 100 people. The counseling unit was right next to the ear acupuncture clinic, and they were seeing far fewer numbers of people. I think that's indicative of what it is that people were looking for. What was filling their need? They didn't want to talk.
This was able to help people without having to explore something that requires verbal trust, appropriate language, and a perspective to describe things that people didn't have. That was the problem. In trauma situation, you don't have trust. Western mental health doesn't work unless you have trust. You don't have perspective, you don't always have the language. Let's say you're not only traumatized, but your language is different than the dominant language. Why on earth should you be able to discuss this? And then furthermore, how many therapists do we have that are so good that they can work with you and whatever subgroup you belong to on the spur of the moment without any money in the middle of nowhere? Why should that be the case?
We simply put up signs that said stress reduction clinic and in parentheses said ear acupuncture. And what was interesting is many people came never having heard of ear acupuncture or understanding anything about why they would be coming for ear acupuncture. But it was clear to everybody why you might go to a stress reduction clinic. And it turned out to be very popular, not only with the staff, but for people in the community.
The object of the game for me and for the people that I work with is to reduce stress for firefighters. And we found that a very simple way to do that is acupuncture.
At the hospital, we already had ear acupuncture available for our clients in the addiction program. So it was a matter of just transferring that to people who would be experiencing traumatic symptoms after a huge disaster such as 9/11.
I have been a psychiatrist at Lincoln since 1969. We were always a little frustrated with the effects of methadone, and so in 1974 we read in the newspaper that acupuncture had been used by Dr. Wen in Hong Kong to help heroin addicts. Pretty soon we realized that we could actually run the entire program based on acupuncture, not on methadone.
We follow the protocol that's been set up by the National Acupuncture Detoxification Association, or NADA.
A simple protocol of 5 acupuncture points on the ear, referred to as the NADA protocol, has been found to be effective without side effects and easily taught to those providing services in healthcare settings. French, German, and Chinese doctors have identified acupuncture points on the ear that correspond to all the different points of the body. These points have demonstrated therapeutic effects on physical, mental, and emotional states.
When acupuncture started to be used after the 9/11 attack, for instance, we had always talked about it previously as being related to addiction problems because we didn't really have any venue to learn how it might be relatable.
It can help both acute anxiety and insomnia without using sedatives and allow somebody to integrate what's going on in a more natural way.
So I went and tried it out myself. I left the old tool building that day. I had acupuncture. I had some kind of massage. I don't know what I think I had Reiki, but I don't know what that is. But I had that, and I drove home to Long Island, and driving home I thought about it. I said, I don't really feel any different. And when I got home, I had dinner, and I said, I still don't really feel any different. And then it showed up later on. That week, I slept 5 nights, and it was the first 5-night sleep I've had since September 10th, 2001. So there's no question in my mind, this is good stuff. I have no clue. I don't know how it works. I have a vague idea how it works. It's not important for me to find that out. I just know this is what it did for me.
One of the advantages of the ear acupuncture in our setting was that it was done at a community hospital. It's done in a large open setting, and that's very helpful. It's not done in a quiet room. You don't know what the therapist is going to do. St. Vincent's was well known to people who live in the area, and the fact that they were offering stress reduction kind of in a non-medical setting, I think drew a lot of people who weren't interested either in psychotherapy or medication.
In the fall of 2005, staff from the hospital was sent down to central Louisiana, and it worked really nicely with the medical team. The evacuees in parking lots who were seeing the medical team for physical problems, some of them were getting ear acupuncture in sort of our parking lot waiting area before they saw the doctor. It was good.
One of the important things after a crisis of any nature is to be able to calm down enough to sleep. And without sleep, we've always known in psychiatry, 3 or 4 days of no sleep, everybody is at risk for acute psychosis. We did questionnaires early on, like what brought you here, what did you experience? It was sort of just basic feedback. And the overriding comments was that people felt calmer and more able to cope. And if you think about it, that really is the goal. And it's both of those things, not just being calmer. If the goal was just to be calmer, sedatives would be useful. But we know sedatives are not useful because people don't feel increasingly prepared to cope. It diminishes the ability to cope and to reintegrate what's going on. So there's something probably unique about ear acupuncture and other mind-body interventions in that what they're really doing is somehow balancing both the ability to be calm and yet alert and prepared. In Chinese medicine, one way I've heard it spoken about is after crisis, the qi scatters. And one question is, how do you help the qi reestablish itself? And that's really, I think, what we're calling regulation, affect and mood, modulation, all these kind of terms. It's really sort of where the future of psychiatry is going. How do you help people modulate affect? What you then have to have are tools that are readily available.
The good thing about this system, it's not only easy to use, but it's easy to teach people how to do this. Of all the things you're going to teach people in crisis, this is close to the safest you could possibly.